Hello everyone, this is Doc Holliday. As usual, I want to first give a shout out to all of my Palestinian brothers and sisters that are out there in the struggle, trying to get their freedom out in Palestine. Currently being held under the influence of an apartheid regime at the hands of Israel and Israeli defense forces, and they have also had their land and everything confiscated. So I definitely wanted to give a shout out to all the Palestinian brothers and sisters that are out there. I'm hoping that soon and very soon you'll be able to have your freedom, and we'll be able to find a two-state solution to you, and where your rights will be respected and upheld as do any and every human being on the face of this earth. Now, this particular message is going out to America, really, at large. As you can see on here on the screen, I'm asking everyone to please wear their N95 mask and to get boosted. As you all have seen recently, unfortunately, we've actually reached a point where at 1 million people that have contracted COVID-19 in one day, which is very unfortunate. Very, 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 very unfortunate. And it just goes to show how unprepared America is in fighting this epidemic, and how ineffective America's messaging has been as far as trying to prevent this disease from spreading. Now I've probably put out probably 30 videos on regards to N95. In regards to COVID, and in regards to properly masking, and in regards to getting the COVID-19 shot. All of which is very important. Also, all of which, including social distancing, is very important. But I want to talk in particular about the N95 mask, and the simple fact that that is the most effective deterrent that you have. Well, N95 mask or the N100 stuff that I wear, that is the most effective thing that you can have, or tool that you can have in your toolkit in protecting yourself from COVID-19. And yet, it's something that is not being mentioned in as far as public policy. I mean, they add it after they say the vaccines, but the fact remains is that the vaccine isn't 100% foolproof. And the vaccines aren't even 95% foolproof. And the fact that you can catch COVID-19 in spite of you being vaccinated, which is the thing that we're primarily trying to avoid, and that is people contracting the disease. And it is true that we are in the Omicron variant phase of this, and on some measures, by some measures, that is fortunate. I guess the biggest measure is the fact that this variant has not proven to be as deadly as Delta, for example. But the thing is that what about what comes next? Because it is, like I said, it is clearly shown that the methods and that we have employed to keep COVID-19 at bay truly have not worked at all. And with the fatigue that a lot of people are having with the disease, with the different rules and regulations that have been going on various stages of the evolution of the disease. It's severely affecting our ability to combat the disease, and it's good that at this time it is being displayed that we are not doing that good. But if we do not change things from this point forward, it's not to say that things are actually going to get better. Now, what it is looking like is that this variant, Omicron, is possibly a derivative that was introduced into the human population from mice. I'm sure that you all may recall that probably the beginning of the pandemic, close to the beginning of the pandemic, they had to kill a lot of mink throughout different nations here in the U.S. and Scandinavia and all these other places. They had to kill mink for fear that the virus will cross back into the human population from the mink and could lead to more deadlier strains and everything. Well, it turns out that this Omicron variant is actually derived from a mouse, it's kind of unfortunate that well, I guess it's fortunate that is the case, that it got introduced in that way. But I'm concerned that our luck may run out, because just like we have all of these different variants, the alpha, beta, delta, and omega, and now Omicron. The more chance that now Omicron will have different variants from it off its chain, and if that happens, and the strain also maintains its ability to reproduce and everything, we could be in store for a huge amount of fatalities. I mean, could you just imagine if the current rendition of COVID-19, Omicron, was as deadly as any other previous variants? Because every other variant that we've had from the beginning of this disease up until Delta has been a deadly disease. It has caused globally an average of 2% of those that were affected. They died as a result of the disease. And we just had 1 million people the other day in the U.S. that contracted disease. So that would be equivalent of 20,000 people that would have died um, from one day's. I mean, from one day's totals of COVID exposures would have of 1 million people. That 1 million people would have resulted in 20,000 people. 20,000 of those people would have succumbed to to the disease and would have died. 20,000 of them out of that 1 million people from one day's total of, contracting the disease. Now, just imagine if that were to have been the case for Omicron. It would be just mind-blowing, catastrophic. The problem is that we are seeing all of the things that are wrong. That number one, a lot of people we aren't having the vaccine mandate, the vaccine uptake. As a result of which, we should have a vaccine mandate. Number two, we are seeing how there isn't a lot of people wearing their mask. We need a vaccine mandate in order, again, both of these measures will be in order to not only keep the infection rate down, but it would also keep the death rate down as well. Because again, if we have another change in the molecular structure of the disease, to which things to which the next version of the disease turns out to be more deadly than this current version, we could revert back to that 2% narrative, and we could also revert back to another more deadlier version than what we have right now. So currently, right now, is as good as time as any, or it should be, it should be the out of any time is the most. This is the most significant time right now to say, hey, people, we have got to mask up. We have got to get vaccinated in order to stop the virus from spreading. I mean, it's just that simple. It's no ends. There's no ins and outs about it, or there's no other ways around it. In addition to that, we need to just tell all the suppliers that are doing the regular surgical masks to just stop selling, to stop producing them, just stop producing all the surgical masks. The government needs to go ahead and give them some money to convert over to the higher quality N95 masks that provide a better barrier for the virus, because I'm seeing way too many people still wearing surgical masks. Surgical masks are not going to protect you from this disease. Number one reason why is because they don't have the barriers, the thickness, the impenetrable barrier that the N95 mask has, that would stop the disease from being sucked into your lungs. It's just that simple. And yet we have still got people constantly, every day, day after day after day after day, either not wearing masks at all, or they're wearing these stupid surgical masks that people have been told like forever to stop wearing. And then on top of that, we have people coming on TV that are purported doctors. They are doctors. But when they're asked by the television host, oh, doctor, can you please clear up this controversy? We have had plenty of people saying that they should wear a N95 mask, or no, you should wear surgical mask. What do you suggest that we do? And these stupid nuts will say, okay, well, the surgical mask isn't as good as the N95 mask, but if you don't have an N95 mask, go ahead and wear the surgical mask. Forget that. These daggone things cost $2. Go out and get a damn blasted mask. You just got how much stimulus money? You just got how much stuff for from your job, from unemployment insurance, from wherever you get your money from. You have enough money to spend $2 to get a mask. The government has enough money to spend $2 to give a damn blasted mask to every man, woman, and child on this damn blasted earth, in order to prevent this in order to prevent this vaccine to spreading throughout the populations. But yet people are not wearing these. It makes absolutely no damn sense at all. We need to stop selling these damn surgical masks, and start having everybody wearing N95. I don't give a dang if you're only doing surgeries in the hospital. Okay, wear N95 masks. We don't need to have any more surgical masks in production at all. And as I said, the government needs to go ahead and pay for the conversion of whoever the manufacturer is that is still doing surgical masks. They need to get paid by the government to switch over and do the N95 mask, because this makes no freaking sense at all. That we are 3 years in the pandemic and we're still having people wearing these damn blasted masks, and that is one of the a serious cause in so many people getting their disease. And they're just not wearing any damn mask at all, and not having the proper hygiene at all, or they're not getting that blasted vaccine at all. And what is this going to do? It's just going to create another variant of this Omicron or Delta COVID-19 Omicron edition. It's going to create another variant of it, or some other variant from some of the other variants that we've already had. And we're just going to keep on regenerating this cycle, and it's going to end up killing more and more and more and more of us every freaking day, unless somebody gets it in their head that says, okay, I would do for self. I am responsible for self, so I'm going to do the best that I can to protect self, because the government don't give a dang about self, about you. I don't know what the hell they give a damn about, but they definitely ain't giving a damn about the person. Oh my God. And then we look at the damn airline agency. It's absolutely, and this isn't the biggest rendition of just basket caseness I've ever seen in my life. I don't know what the hell is. You get thousands of flights being canceled every day because of employee shortages. How many other companies are having to cancel things, or having so many people call out of their work environment? And then when you look at the type of mask that they wear, that they make you wear in the airlines, you can't wear one of these high quality masks, because they claim that, oh well, your when you breathe out, droplets will come from this. Shut the fuck up. So they give you a cloth mask, all right? They give you a cloth mask. Hey, you need to wear this cloth mask. It is about protecting yourself. We want to make sure you don't spread it to anybody else. So here, this word is cloth mask, and that's going to protect you. When time after time after time after time after time, everybody knows, I don't give a dang if you are recommending people to wear the cloth mask. You know damn well and good that the cloth mask is a hell of a lot less effective than the N95 mask. But yet you have all of these damn dumbass airlines saying, okay, well, I don't care what kind of mask or whatever anybody else is recommending you wear. We're going to give you cloth masks. We're going to give our employees cloth masks, and we're just going to ignore every damn thing else. We got people getting sick out the wazoo. We're not going to reevaluate any damn thing. We're going to keep it rolling because we don't give a fuck. They're not even giving people their money back. No, they're giving them credit. Oh, you have this credit. You can go ahead and use this credit whenever you like towards your next flight or whatever. So they're keeping all the money. They're keeping all the money. They don't give a damn blasted how. I mean, and then, oh God, it's just like, okay, people should see that, and they should say, even if it's not the airline agency, the aviation transportation, the transportation aviation board, whoever the heck that place is, like, there needs to be some kind of oversight and looking at the health of these airline stewardess. The reason why they die, or the reason why they're coming sick, is because of the fact that they're not wearing the proper equipment that is keeping them safe. So if they would get the proper equipment, even a KN95 or an N95 mask would suffice. Not the cloth. Oh, they want to make cloth masks so they could put their airline on here. Oh, I want to have this airline and that airline and this airline. And we're going to just have them look all nice and dapper, not giving a damn about the efficacy of the actual masks in which they're actually giving to their staff. Listen, for the new year, I am recommending everybody to get their what do you call it? Life insurance policy up to date, especially if you have any kids or anybody that that is benefiting or whatever from the money that you're bringing in, or if you are supporting a family or something of that nature. I would recommend that you get a life insurance policy, because I think it takes like 30 days or something like that for it to become effective anyway. So if you like dying, about to go into excuse me for laughing, about to go into the hospital or whatever, you can't go and just go to the internet and say, oh, I want to fill out a life insurance policy to give out $1 million to my daughter. That ain't gonna work. Not on your deathbed. You have to do that prior to that point. So I would actually recommend everybody to go ahead and get their life insurance policies done for the new year. You're not gonna do this because you can't even damn follow simple instructions to prevent yourself from getting COVID-19. But I have to at least give you the information. You decide whether or not you want to take it or not. Let me think. What else is there that I want to say? I don't know. Like, we're in a sad state. I would also recommend people to contact the CDC and contact NIH and tell them that they need to do and put more stringent policies in place to protect the people, because And everything that that the CDC is doing is actually looking in the rearview mirror to get policies or whatever, instead of looking forward. Like, for example, this new um, advisement to go to a 5-day quarantine after you've been tested or whatever. Listen, that is the biggest setup for failure I've ever seen in my dang life. Number one, you're not even guaranteed that you're going to be rid of all of the infectiousness that you have. Let alone if it's in you or if it's in your clothes. Hell, we already know that the virus can last like 72 hours without sun exposure or whatever. So then you're going to tell people, okay, you're only just, I'm not even going to go there. People, do not listen to the CDC. Have second and third thoughts, like, unless they, it's like, how do you solve this problem when you have morons in leadership? I'm sorry. You have morons in leadership. And the president should fire this moron in leadership. Number one, what was it? What was the first thing that she had done that was like, what are you doing? Oh my God, I forget what it was, the first thing she had done. But it was like, are you freaking brain dead? Like, what are you doing? But now this is the second thing that she has done. And believe me, there's going to be plenty more that she's done. That lady needs to be fired, and Fauci needs to be fired as well. Because they're complete morons. Their messaging is all effed up. Their policies are all messed up. And it's going to cause more and more and more people's lives. If we continue on with doing only this 5-day quarantine, as soon as that next variant spins out or whatever, you're going to have thousands of people being affected because what's going to happen is they're going to still be going on this old rule of a 5-day quarantine or whatever, and this new variant is going to come on in, and it's going to be still contagious for 7 days or whatever after first being tested positive, and it's just going to just roll over of hundreds of thousands of extra people that would die, that didn't have to die, that would die because of this ill-advised notion of only going to 5-day quarantine. Okay, you want to trim it down a little bit? Do what the other European people are doing. 7 days. Go do a 7 days quarantine or something like that. Not half, not 5. You are just dumb, and you're putting too much. It's too much of a risk of just going to the 5 days. Add an extra 48 hours to it. Be more conservative on your approach to make it, as opposed to put more and more people at risk of freaking dying. And it's just like these monotone people making this astronomical amount of money on and not giving a damn about the people of which they're supposed to be protected is absolutely asinine to me. Today, right now, America has freaking, 900,000 people that have died from this virus right now. 900,000 people that have died from this virus right now, right? Okay, we getting a million people, 500,000, a million people, somewhere in that range, infected with this virus every day. Now, you not only have to worry about death with this virus, you also have to worry about long COVID. Long COVID affects anywhere from 8 to 15% of the people that get this virus. So that's anywhere between 80,000 and 150,000 people that are due to have long COVID as a result of 1 day's worth of infections. Just in the United States alone, just within the United States alone. So that's 80,000 to 150,000 more people that are going to possibly have long COVID. And it's just a 1 day. 1 day's worth of people. There's 30 days in a month. 365 days in a year. How many people are we going to have to be affected with this stuff, possibly for the rest of their life? Possibly for the rest of their life, if not for an additional 1 or 2 years, to which they're not going to. It's people aren't thinking. I don't know why people aren't thinking, but people aren't thinking. America, you have to be in control of your own safety. Do not simply just look for the government to give you the best of guidance. You have got to do your research, and you have got to accept the research as fact and adjust the safety, the things that you do to provide safety for yourself and your family as a result of the information that you obtain from that research. Now, a lot of people don't know how to do the research. Then you look at stuff from the news and it's all confusing. Just listen to me. I'm telling you straight up. I've been saying this, like, you can check all my videos. All of them. Everything's been pretty much straight along the line. Straight and narrow. Protect yourself, protect yourself, protect yourself, protect yourself, protect yourself. Wear an N95 mask. And that's not going to change. And it's probably not going to change for another 3 years. Well, you know, if we ever decide to actually want to stop this disease, you know, it'll begin 3 years after that point. So the clock is still ticking. I say 3 years, okay, maybe another 5 years, until we get somebody in the White House and that really actually wants to actually solve this disease, because it's like they walking around with their hands behind it, tied behind them, and eyes closed and mouth, you know, sealed up, ears sealed up. They just, you know, just walking around ignorant. We are human beings. We are the advanced people of this earth. Like, we're not supposed to be as dumb as these dang other species that are walking on this earth. You know what I mean? Like, and we have the information. We have $2 masks that can do things to save. And again, these are disposable, people. These are just, do not carry these masks back into your house once they've been used, because odds are that them are infected, like contaminated. When you take off your clothes, you also go check out some of my other videos that I tell you about how to do your clothes or whatever. But I'll tell you one other thing, that is, I don't have my I don't have it around. Where is that? This must be in my bathroom. Another thing you could do is some dang on Lysol. When you're at work or whatever, when you come home, before you get in your car and everything, you can take off all your clothes or whatever and like put it in a bag or something like that. Or you can grab some Lysol and ten seconds, 15 seconds, 20 seconds, fuck it. Alright, Lysol, that stuff would clear out, that way it'll get all of that, whatever whatever COVID stuff or whatever off of your clothes before you go step your booty in your car. Make sure you have your mask off or whatever, you know what I mean? And masks thrown away, because again, you're having disposable ones, or you having something like this where you can have like some wipes or whatever that can actually you can wipe it off or whatever once you leave the work environment. So, but that way you can, not carry anybody else's in COVID junk on into your car and therefore into your house um, with you, and therefore affecting you and everything. Remember, these things are disposable. These things are disposable, and we need to again restrict our travel. I hope everybody is not going out to those dang on basketball games, football games. Acting like things are just a-okay. Everybody got their vaccine and all this other stuff. Everybody ain't getting no vaccine. Everybody ain't doing what they're supposed to be doing. You have to be doing what you are supposed to be doing in order to protect you. Don't count on somebody else doing the right thing and thinking and allowing that thought to end up making your behind being in a dang on infirmary or in a hospital clinging on life support. Let's be proactive in protecting yourself. I've said this from day one. You're wearing this mask not to stop the transmission to other people. You're wearing this blasted mask to protect yourself from getting the disease. That is paramount. That you have to protect you from contracting disease. So wear a freaking mask. There is no indicator on any man, woman, or child that walks across your face that says, hey, I have COVID, for you to go ahead and put on your mask at that point in time. No, there's none of that. Nobody has that. So you need to wear your mask 24/7, 7 days a week. Whoever that you're in front of or whatever, and do it diligently, and buy a freaking box of these things. Buy like a huge box of these things. They're on Amazon. These are like 50 or something, 50 pack of them, of these bad boys right here. And I don't know, it was like $20 or something. Well, I actually got these on a heck of a sale. I think I probably paid like $8 or something like that for these mugs. But the regular price like $27 or whatever on Amazon. You can get it. Get them. Get them. Protect yourself. Protect yourself. You only have one life. Once you mess up, there's one life, you're gone. And you're gone forever. You are gone forever. You can't look back and say, oh, this is government fault. Please don't take me. It's government fault. Please don't take me. No. You are responsible for you. I don't care if you're 95 or you're 5. You are responsible for you. You are a tiger. Like you are a lion in this mud, and it's a jungle out there. And fortunately for you, God gave you a mind to say, okay, son, there's some danger here. You need to do whatever you can to protect yourself from being in danger. So what do you want to do? How do you want to protect yourself? That's the question. So with that being said, I'm out of here. I hope that everybody takes this and is well received. I hope that you're finding the energy and everything, and you understand the way I feel, and hoping that you all, black, white, Chinese, Mexican, wherever, protect yourself. You know what I'm saying? Protect yourself. And share this to all of those people, to everyone. Share this video. Because as you can see, people are not getting the message. People are not getting the message. And all it takes is when this Omicron just takes that one switch, when it takes that switch and becomes more deadly, it's just going to knock out so many dang blasted people. Because it's going to be like, oh, this is Omicron. This is a flu. Not a flu. This is a cold. We don't have nothing to worry about. And it's going to mark now swaths of people, and everybody, it's going to take 3 months for CDC to be like, oh, okay, we need to go ahead and change our rules. We no longer can only do 5 days quarantine. You need to do 20 or 10, the regular 10-day quarantine. This was so stupid. It's like there's no foresight in this at all. So as a result, please, 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 I implore you, please do whatever you can to protect yourself. Please. Thank you for listening. Please wear your N95 mask, and only N95 mask, and please get your vaccines, and please get your booster shots. Thank you very much for your attention, and you all have a wonderful and blessed day. Bye bye. Oh, and a safe and happy New Year. Thank you.